Hello, my name is Stephanie Zanbetter. I am a physical therapist at Gaylord Hospital. I work here as a clinical specialist for stroke, and we're going to be discussing the anatomy of a stroke and risk factors. We're going to begin with just a definition of a stroke. A stroke, simply put, is a disruption of blood flow to the brain. This can be, of course, problematic because our brain, like every other organ in the body, requires oxygen in order to function. When there's a disruption of blood flow to the brain, we're essentially talking about a disruption of oxygen being delivered to the brain. And therein, of course, lies the issue. There are two types of stroke, so we're going to spend a little time today talking about the different types of stroke. The most common type is the ischemic stroke. Most common, about 80 to 85% of strokes are ischemic in nature. And ischemic stroke is one that is caused by a blood clot. The other type of stroke is a hemorrhagic stroke. Hemorrhagic strokes are less common, so about 15 to 20% of strokes are hemorrhagic in nature. A hemorrhagic stroke occurs as a rupture of a blood vessel or a bleed within the brain. And so we're going to take just a second to kind of look at just the images that you see here. In this, the ischemic stroke, what you're looking at is just a simple slide here, really showing healthy brain tissue, healthy segment of the brain rather, and then also this red line that you see is representing oxygenated blood flowing within the vessel. What you then see in the depiction here, of course, is that there's been a disruption, right, of that blood flow in the vessel. And so now you see just discoloration, certainly within the continuation of the vessel here, and then also represented in the change in tissue and color. In the case of a hemorrhagic stroke, right, so different cause here, but same type with respect to picture. So healthy brain tissue represented here, and then again, your healthy oxygenated blood flowing within here. What's being depicted here in this picture, though, is there's been a rupture in that vessel wall, and so now you have blood going into areas where it does not belong. And so one of the members in the class had asked once, well, which is worse? And so, in all honesty, the answer to that question is that neither one are good, right? But they're not good for different reasons, all right? And again, in the case of an ischemic stroke, we're talking about a blood clot as far as the cause of the disruption of flow. And in the case of the hemorrhagic stroke, we're talking then again about a rupture of a blood vessel. For the purposes of introducing the risk factors for stroke, we're going to talk a little bit about some of the risk factors that you can control as well as those that you cannot. In another presentation, we'll go into a little bit more detail on those risk factors that are controllable and spend a little time discussing stroke prevention. For the purposes of right now, it's really just to kind of introduce them, okay? And so those risk factors for stroke that one cannot control are inbred for you, and they are age, gender, ethnicity, family history, and then prior experience or having had a previous stroke. The list of risk factors for stroke that are controllable, highlighted in green for you, are high blood pressure, smoking, diabetes, physical inactivity, cardiac arrhythmias, specifically atrial fibrillation, clotting problems that are associated with other medications that one might need for other medical conditions and treatment of those conditions, high cholesterol, stress, and then excessive alcohol intake and/or substance use or abuse are also considered to be controllable risk factors for stroke. With respect to the acronym FAST, this is particularly important in that it is designed to help the stroke survivor with identifying the warning signs for a stroke, so how to spot if a stroke is occurring, right? And so we'll go through the acronym in just a moment, but ultimately this was designed by the American Heart and American Stroke Association to help individuals with, again, recognition of stroke warning signs. Okay. The F in FAST stands for facial drooping. So we would ask the individual to smile, right? And if one side of the face is observed to droop downward, we'd say that's the first sign or symptom. The A in FAST is arm weakness. So we might ask the individual to raise both arms up overhead. If they are not able to do so, or if the arm kind of comes downward, we'd say that's the second sign or symptom. The S in FAST stands for speech difficulty. So we might ask that individual to repeat a simple sentence like the sky is blue. If the words either don't come out or sound garbled or slurred, we'd say that's the third sign or symptom. The T in FAST stands for time to call, or time to call 911 ultimately. And that is the idea, of course, that time is brain, and so at first recognition of symptoms is the best time to call for help. There are some other organizations, if you're looking online, you may see the acronym BFAST, and that is to include B for balance, which can change essentially at time of stroke presentation, and E for eyes or vision, which can also change at time of stroke presentation. So what we've learned so far, right, about stroke is we talked about the general definition of stroke, again, a disruption of blood flow to the brain. We've talked about the different types of stroke. The most common type being the ischemic stroke, again, that's the one caused by a blood clot. The other type of stroke being hemorrhagic. Again, this is the one caused by a rupture of a blood vessel or a bleed within the brain. We've listed out for you the risk factors for stroke, both that are controllable as well as the non-controllable risk factors. And we've discussed the acronym FAST, which is designed to help you with recognizing the warning signs for stroke. Thanks again for watching, and we encourage you to check out some of our other educational videos offered from Gaylord Hospital regarding stroke.